really think that from the point of view of people that are in schools, I said this morning, we have an urgent need to be partnering with community mental health or brain health. There's just a dearth of mental health services available to teachers to use, not so much with the kids, but as the collaborators and as people who can brainstorm cases with them and give them some ideas as to what they might be looking at in the classroom. So that's a potential partnership that I intend to go back to my community and work a little harder about. Another one that I don't know how aware you are of this, but when I was a program director, I became aware of all the free things you could get for collaboration, because that's what program directors do. And most universities do have people that will do pro bono work for you in your schools or in your other community agencies. They also have these wonderful things called interns, I should say. And you can usually negotiate with them to extend the period of time of the internship so it's better suited to your year, whatever it is, whatever your service delivery hours are. And then, of course, Robert mentioned this earlier today quite a bit, community opinion makers. Who are the people that have the most power in your local community? And I would go for the people that have the informal power. You know how power is. There's people that look like they have power because they have titles. And then there are the people that have all the power because they say things behind everybody's back and they get things done. Right? Do you have a hand up because you have a question?
Yeah, our healthcare systems.
Do you want to ask it now?
Yeah, I think that we need to include our healthcare systems.
Okay, can somebody give her a microphone so we can hear?
I think this wants healthcare systems to be added.
Oh, add healthcare systems. I'm sorry. I need a hearing aid up here too. Sorry about that. Yeah, I think healthcare systems are another really good group. Yes?
I'd add the Department of Mental Health as well as community mental health.
Okay. Any other takers?
Family justice
Any other
centers.
ideas?
Faith-based partners?
Okay. Anything else? At least it's getting your mind running, right? The last one that I had on my list comes from the idea that, again, when I was a program director, this was quite a long time ago, but we organized with the local police department, and there wasn't a single kid that came up like as a high-risk kid, that we didn't convene a group of people from mental health, the police department, and the school system to kind of staff the kid and come up with an intermediate plan to try to take care of him before he went any further or she went any further into the juvenile justice system. And that seemed to really work really well for us anyhow in my local community. And then this is Deborah. Okay, reasons for collaboration. You really do need to have a plan for how you're going to do this. And people that work in social services are notoriously not great at planning. So we kind of run from one thing to the other. And I think that as we think about the ACEs research, we're at an advantage because there is a rather well-accepted shared definition of what the ACEs are and kind of a conceptual understanding of what they look like. So we're kind of ahead of the game there. But I think it's important to think about involving the people that are the most affected by the presenting problems and identify targets and agents of change, who can benefit and who can help. And it needs to be, I think, outside of our comfort zone. In my hometown, I live in kind of a small hometown, but I would say that the business community is underutilized in terms of solving social problems. We go to other social service agencies, but we don't often go to the people that own businesses in the town. I used to run a program for kids that had disabilities, and I was always trying to include them. And I wanted them to have places of work when they graduated from high school. So I started introducing them to local community business owners when they were in about 3rd grade. And they kind of became friends. And then they kind of became helpers. And by the time they were in high school, they had part-time jobs. And there are still some of those kids that are working in the community as a result of that. And I think that's kind of the long-term planning that we want to be kind of thinking about creatively. Anybody up here can jump in whenever you want.
Can I jump in?
Anybody jumping?
Can you
Yes.
hear me? I would actually say the number one reason to build a collaboration is it's what clients want. They want a more efficient system. They don't want to keep going from agency to agency telling the same story with a disjointed, siloed response. And our IT director recently took all of our partner agencies' intakes and started calculating the numbers. We collectively asked clients over 600 questions. The majority of them were duplicative. Name, date of birth, social security, whatever. It doesn't need to be like that. You can share information responsibly with the client's consent and reduce barriers. So it's what clients
That's a
want.
really good point, really good point. It's kind of like going to the doctor's office and filling out the same form. Yes.
I've learned this from my colleague Laura Porter, who was in the film Resilience. She's really brilliant at bringing people together. One of the things that she does is she goes out and she looks for the mid-level managers in organizations. And what she's taught me is those are the people that have way more power than you might think they have.
Right.
And they run the budgets, they know the people, and they oftentimes have discretion over how their budgets and personnel are used. And things can happen very quickly by targeting that way rather than trying to work from the very top down. So in terms of engagement, that's one of the things she talks about. And the other thing she talks about is this sort of grassroots community level. She talks about expanding leadership. And in the models in Washington, when they went in and taught and they had community meetings, leaders emerged that you wouldn't think would be leaders. And to be open to expanding that beyond identified people is something that she really uses in her community work.
It's a great idea. Thank you. Anybody else? Keep going.
Is there someone right there?
Yes.
I was saying that you can sometimes have collaboration in your local city environment, like such as the city of Edmond. They're coming up soon before Easter to have a big citywide Easter egg hunt at a local park over here. And so that could be an outreach center for you to have tables and share information about cases. And also a really good one I actually think could be too, if you could work with your local school district and get it into all the schools for the counseling departments also, having that awareness of it. I don't know if they do or not, here yet. But also your local military bases, like for Tinker Air Force Base, they are involved in community activities a lot of times. I've worked with a group that they contacted us to come on to base and give presentations or something like that, with it. So you could do that, spread the information, and that's very collaborative, also. But like the stress is on a military base for a lot of, the military personnel, with a lot of constant news, and kids in school, things like that. So it could be real interaction with stress. So that may be a really good environment. And it's not too far from here. We have, several military bases in, all of Oklahoma, but we've got Tinker right in the city.
Susan?
Thank you.
Susan, down here.
Down here.
Oh. Hey, hi.
I'm in her
Sorry.
blind spot. I thought this was a good time to just give you a little update on what is happening in Stillwater, because Stillwater is a little bit further down this road than most other communities, and it's largely due to that woman right over there, Carolyn McAllister. There's some Stillwater people here, but I just want to briefly tell you, she basically took out her contact list about a year ago after there was a screening of the film Resilience in Stillwater, and a lot of people came, and there was this sort of interest. And so she started, I still call it a Rolodex, but she got out her list of people and called them all and booked the hospital auditorium kind of meeting room for an 8 a.m. meeting last June. And over 100 people showed up. Dr. Sudlett was there. There were a lot of people in this room, Camille. So we have people from the school board, principals, and the public school office, the physician's offices, the mental health services, Head Start. Then there were the police and law enforcement groups, and then policy groups. So there are 4 subcommittees that have been meeting regularly. I can attest to the regularity of these meetings and starting to get things done. And now the police chief is wanting trauma-informed training to be done for the police people, you know, all levels. The schools are talking about how can we get Miss Kendra's list into the Stillwater, all the pre-K and kindergarten programs, and can we do this kind of in a research way so that we can measure the effects. It's kind of like the grassroots grass fire that we talked about earlier, but it did take a couple of people who really cared passionately, and a few people who have good organization skills and lots of contacts, and a willingness to keep knocking on doors and making phone calls. But I'm watching it happen, and I'm sure Carolyn, wave, will be happy to talk with people after. 'Cause she really did make this happen. But any of us who are part of it, and there are a lot of Stillwater people here today, would be happy to tell you, because if little Stillwater can do it, you know, so
My
can.
co-coordinator's over there, United Way, Sherry Carter.
Is Sherry here?
Yes.
Sherry Way. Sherry paid for, she's the director of United Way. They actually paid for a copy of the film Resilience and got the city manager, I believe it was, to agree to show it on the city channels, on the 2 cable channels, every night between, sometime in September and the day before Thanksgiving. So there are lots of good ideas out there. Just talk.
So, okay. So my niece is part of the Norman Junior League, and she also is a page at the Civic Center Music Hall in Oklahoma City. So she's an usher, not a page, and so she had already seen Resilience, the movie. And she invited me to come and speak to the Norman Junior League. And I'm only telling you that connect the dots story to let you know that there's probably more groups that are interested and available if we just even ask or talk to our own connections. Thank you.
It's like trying to raise money. If we just ask people, they will do it. Yeah. I think you're right. I was just thinking as you were speaking that I think this is a great program that makes use of collaboration with senior citizens in New York State, where, like many states in the country, they're having a really bad problem with opioid addiction. And so there's lots of children in foster care, and too many for the system to absorb. And so what they've done is they've collaborated with several assisted living places who go and spend 2 or 3 hours several days a week playing with different foster children. They can't take them home with them, but they provide respite for them, and they provide some friendship and relationship with them. I think that's just a great example of collaborative partnering. I just love it. So you could do that. Okay, because there are people that we don't think about often enough, I think. Yes. Do you need a mic?
I'm kind of loud. It's relatively cheap to do social media, like Facebook promoted posts. What about like some PSAs that get pushed out through that?
Okay, want to repeat that?
It's relatively inexpensive to do Facebook promoted posts. What about some like PSAs that get pushed out through that?
It's a great idea. Yes, get things on the street. Anything else? Any other? Oh, good.
Hi, my name is Ashley Godwin, and I'm with Ardmore Behavioral Health Collaborative, so we're a little further south. But in the last year, our collaborative was formed with a lot of community partnerships, and what we're trying to do is make Ardmore a trauma-informed community. We're working with business leaders and our social service agencies and our healthcare providers, mental health providers, and so on. What would be really helpful for us, because it sounds like we have some great opportunities to connect within the state is a platform or a forum to do that. We have hired the National Council for Behavioral Health that have been assisting us in our journey during this last year. However, they're from different parts of the nation and don't necessarily understand the struggles and the issues that we're having. And so in being here today has been very eye-opening in hearing what's happening, all of these really great things that I feel like I can get some wonderful feedback from the people that will understand where we're at.
Thank you. Thanks for that. Over here.
Is it working? Okay. I want to definitely second the idea of some sort of platform, a universal place for those who hear the word resilience to go to and to just kind of have that Google app available. I know that there's an international website, but something more Oklahoma-based. And I'd also like to give a little bit of attention to the fact that our state is in a huge budget crisis, and everybody is extremely stressed out. In the Resilience movie, they talked about mindfulness, and I haven't really heard anybody else tap on that. I personally am teaching, I pick a nonprofit every year and do a mindfulness seminar for them, but I would like to include some sort of self-care tactic like mindfulness with this collaboration and this resilience movement, because trigger warning or triggers and vicariously passing on stressors, especially in the organizations that manage these sort of children, is going to be very important to the success of this, or else it's just going to end up being yet again another piece of paper and another step in a policy that they really don't care about because they're burnt out.
That's a really good point. Really good point.
Yeah.
Pat, did you want to comment?
My question is about rural communities. How do we build these partnerships in rural communities where the resources are a lot fewer and harder to find? So what advice do you have for those where we're working with a lot less to start with?
You guys may have some things to say about that, but just to kind of pick up on some of the comments about where do we go, what do we do here in Oklahoma. acesconnection.com is a website that we have found to have the greatest number of resources. Several states have created communities within that website, and local communities have also, some that are 10 years down the road in this effort. And we have, at the Potts Family Foundation, been in conversation with them, and they would like to see an Oklahoma presence, and we are willing to start that. So they're getting the website ready. I don't know anything more about it except that we think we'll probably call it Raising Resilient Oklahomans, unless somebody wants to come up with another name. And as soon as we have that information, we'll get that out. We have all of your email addresses through the registration, so we can push stuff out that way, and then we've been putting our social media stuff. Just stay connected with us. They told us it might be 4 to 6 weeks for that to get prepared, and then it'll take a while to populate it. But there's so much opportunity there. They have modules where you can do data tracking, and there's forums, and you can and go out there now, because you can see what other communities are doing, and you can join forums and ask questions, and they have toolkits, and it looks like a great resource.
Say that website again.
acesconnection.com. And they actually have a document called Getting Started 101, I think.
And we had a flyer out there on our.
Margie has a flyer out on our table that just directs you to that website. There won't be anything about us here yet, but through the website.
I would say acesconnection.com is full of information. But it's not really, what's the word?
Evidence-based.
Edited.
Edited.
It's not, so.
It's not moderated.
It's not moderated very closely. So I get it. I get an email from them every single day, and I find stuff that's fabulous, and I find stuff, well, okay, grain of salt. So just be mindful when you go on acesconnection.com that sometimes it's about one person's experience and this is what worked for them. And it's not necessarily evidence-based. There's nothing else to support it. But it's a good place for people to connect. And while I have the mic, I do want to say something about mindfulness. Because when we were discovering, kind of by accident, stumbling over ourselves, that the parents at Educare that we were working with were having trouble with the programs that we had gone to great expense and great effort to put for them so they could improve their lives, and they were struggling so hard with them. It was because of the cognitive deficits of their own childhood ACEs. And we found the only thing that has evidence of changing the brain after a fairly short period of intervention, changing the brain in those areas we want to change, the prefrontal cortex, the amygdala, the hippocampus, which is the seat of your memory, was mindfulness-based stress reduction, MBSR, a program done out of the University of Worcester, looks like Worcester, you know, I can't say it.
That's
UMass.
That's the Okie pronunciation.
UMass in Worcester, Massachusetts. John Cabot-Zinn has done mindfulness-based stress reduction, originally designed to improve outcomes in cancer and heart disease patients. But it actually helps parents learn how to self-regulate, learn how to remember, learn how to problem solve so they can help their children learn these techniques too. So I did want to say the mindfulness is a really good direction to go.
Web resource, California Clearinghouse. California Clearinghouse for evidence-based practice, that's not exactly.
I think it's not being updated anymore. I looked at it the other day and they said they've ended their funding for it, but it does, at least for now, have interventions that have evidence, or they're promising practices, or there's no evidence for them at all.
California Evidence-Based Clearinghouse for Child Welfare. I'm looking at the website. Thank you, Lucia. And a lot of you are familiar with it because a lot of you use the programs that are on it, like ABC or Parent-Child Psychotherapy, CPP, Child-Parent Psychotherapy.
Yeah, I wanted to respond to the question about rural communities, if I could. I think a lot of times rural communities they often do not have the same kinds of resources or same breadth of resources maybe the cities are. I will argue with you that the cities have resources that have waiting lists that are 9 months long, so that's sort of, you know, relative problem as well. But don't think if you're in a rural community that because you don't have something that you can't get it, because you can get it, you have to sort of organize. But we've seen communities where, for example, youth services centers have been created in a community, or they've worked out relationships with nearby colleges to promote bringing mental health providers into their communities, or those kinds of things. I think the most important part is getting some people together and starting to lay out a plan for what does our community actually need. And so, for example, we were working in a community where there was no presence really of mental health providers for children or adults, lots of problems with drugs and brain health, and worked with that community to figure out creatively, how are we going to go get the services? So we can't just sort of, it's a little bit of a cop-out to just sort of say, well, this is how we are, how do we function with how we are? We have to go get what we need. The other thing is, I'm going to tell you, we've worked with communities where it was the Speaker of the House, or it was a legislator, or somebody, it was some farm guy from that community who had a lot of influence. Go work with those people. They will help you accomplish some of the things that you need to get for your own local community. So I hate to see, I came from a little rural community, I hate to see rural communities kind of feel like we don't have anything. Go get it. It's worth going to get. I don't care if you're a community of 1,000 people or a community of 1 million. Your people are just as valuable.
Yeah, I would argue you have the relationships in a way that bigger cities don't sometimes.
That's right. I'd also add that there is such a thing as decentralized service delivery. So if you're in a more urban environment, there are ways of reallocating resources to rural communities, like on a part-time basis. And it's a little hard on the service providers because you drive a lot, but it's well worth it in terms of what can happen for communities. Yes. I think we need a mic here. Oh, sorry.
Okay, so there are, for any rural communities that do not have access to a lot of resources, the Bridges framework for communities. Deborah Price is a statewide coordinator, and she provides free technical assistance to communities across the state of Oklahoma. Right now, there's over 23 communities that are bringing people together to coordinate, collaborate, utilize resources that are in the area, and each community looks a little bit different. But if you need her information, I'm happy to share it with her. But Deborah Price, she's with the Salvation Army, and she's a statewide coordinator for this.
Okay, thank you for that. There's a question up here, if we have a mic. Or comment.
I have a comment I'd like to add.
Okay, next.
I'm Denise Howard. I'm with the Children First program here in Oklahoma City. And I just want to add, as a partner for the collaboration, I think definitely you need to include home visiting. Almost my whole team is here, and I know there's part of the team from Tulsa City County as well. And we use the Nurse Family Partnership model to do in-home parent support programs. Our particular model is for first-time moms that are working with them from pregnancy till their child's second birthday. And so we are working on a collaborative with Dr. Bard through an innovation grant where we're just kind of getting started with Organize for Life and learning how to do the ACEs studies or administer, not the study, but the questionnaire with our clients. And so we're really interested in, after doing that, how do we then help them with this resilience piece, which is why we're here today. But I think all the home visiting programs in the state are definitely, need to be included in the collaboration and work as part of this, because we touch those people very early on, in the process.
Thank you for that. Okay.
Oklahoma has a great network for telehealth. There's a Telehealth Alliance of Oklahoma, and so we've got great infrastructure where you can bring expertise of these specialists. I mean, I'm not saying to supplant the travel and the on-site, but there's things that you can do incredibly. The Chickasaw Nation does incredible work with telepsychiatry because they can't get a psychiatrist to go to ADA, so they augment their integrated behavioral with that. Same thing here, they've done a lot with court cases and all sorts of healthcare and education. And the Telehealth Alliance is collaborative, and it has all the major, health systems that have telehealth and other not-for-profit partners that would, I'm sure, be willing to provide technical assistance and guidance to make those connections if there's interest for like the Idafelds or the Hugos or the Bessies or the Hobarts.
Excellent. Thank you so much for that.
There's also something called Project Echo, which I know OSU is doing, and it may be a little bit separate. It's a model out of New Mexico.
Yes.
Colony Fugate was here just a minute ago. She does the childhood obesity one. Jason Beeman is doing the psychiatry one. So every community, almost, every county has a physician who could get on the roster to have their case discussed at the Project Echo meeting there every Monday.
Right. The ECHO is the Extension for Community Health Outcomes based out of University of New Mexico, Dr. Sanjeev Arora. And so Oklahoma State has had that. It's awesome. It's physician-to-physician guidance, like a specialist to primary care. And that's another great resource that you all have no issue.
I'd like to add, if I could, about the ECHO. I have partnered with the University of Arkansas neonatal group on a teleeducation project. It's a teleeducation project. It's, either a lecture or something. They needed Native Americans, and the NIH said, you should contact Oklahoma. We have them. They have Native Americans in Arkansas, but I guess they don't know that. But so it's a great opportunity for an education program. I've also partnered with the Baptist Integris System, and they have this it's simply a lecture, but simply a lecture for physicians and staff might be another good place to start. And I'd be happy to help facilitate that, because I've already talked to a couple of people from Integris, but I've contacted Jim Lewis of the Cherokee Nation, and we just had 4 site visits at the Chickasaw Nation in their major spots to also do this. So maybe this is another way that we can begin to expand that.
That's a great idea. Hey.
You mentioned in BSR, the John Hudson program. Marty Kennedy, a local practitioner, is getting ready to offer that workshop. She trained under him through the Integris James L. Hall Jr. Center for Mind, Body, Spirit. It begins on March 29th.
Great.
So if somebody's interested in getting trained in that, there's an opportunity for that. She offers it in the community. And then all of Dr. Christian's videos and audio podcasts on mindfulness are available for free through the Integris website. So that's a resource.
Great. That's fantastic.
Okay, let's go on to coalition building. Again, Deborah did a great job of talking about why you need to do this and who needs to be involved, so we won't spend too much time on it. But I think what I took away from her conversation, and also when I was getting ready for this afternoon, is the need to involve the people that the problem really affects the most. I think sometimes coalition building is seen as having like a lot of people that have degrees sitting around talking about the problems of the people most affected by the problem. And I think we need to really think that through a little bit and begin to have a little bit more of a inclusive attitude. Would you agree with that? That's kind of what you're saying.
Yeah, actually when you all were talking about that earlier this morning, I was just thinking what a terrible job that we do as the Department of Human Services and Child Welfare at even asking the parents we're serving to, beyond just engage in the plan that we're going to tell you to do. Like that's kind of our version of engagement. There's not very much. And so we have been talking about how do we involve parents as peer mentors for other parents and things like that. But I think there's a need for us to involve them in the planning and development of programs from the beginning, not just in sort of peer-to-peer or things like that.
Right, I agree with you. Our mental health program in my town does a peer-to-peer art program every year, and they involve different clients from the mental health center with different artists from the community, and they kind of create a community among themselves. And that kind of extends them back out into the community in ways that are really kind of surprising in terms of providing support to people that may have some mental health issues. Okay.
One of the things that I loved on that note of bringing in people in your last slide was when Kim came together with the best practice model of collective impact and having all the agencies together. She brought together 49 different agencies and stakeholders together for a 2-day strategic planning prior to their focus groups with every type, with all the victims, not all the victims, the types of victims, the focus groups to make sure that their voices and what their needs were to come from their client first. So with it's Dr. Shaw hired like the children to really look at what's happening and the barriers for the family. That it was something that I would encourage any community or this group to consider doing as well, that having everyone at the same, and we can tell you not everyone got along. There were a lot of, as Dr. Anda once said, there's a lot of silos. There were a lot of people, money, who were doing their own thing and didn't want to get together. But when they sat down at the table and they started with client first or child first, then everything started to make sense and they were able to work together. But I don't believe that we would have opened up Palomar had him not make sure that there was buy-in by all of the community partners. And by that, anyone who was coming together and that the diversity of the clients and the diversity of the partners could understand and start to actually work together. And then in doing that, the efficiency of service really brought a lot of community leaders too that were outside partners that would not have necessarily been the known stakeholders, but the people who are now helping to share the message.
Right.
Hi, I just wanted to comment a little bit about the coalition and building coalitions. I work with the Department of Mental Health and Substance Abuse Services, and systems of care is in all 77 counties of Oklahoma. And we have coalitions in that meets every month. They talk about all different kinds of things. I know that Deb was part of our communities of care that we did reach before, but we're all over. And we're always looking for new partners to strengthen the work that we do. Community mental health agencies typically are the ones that's promoting and helps facilitate those meetings. But there's one in every county.
Wow. That's a good framework to do a lot of other things, right?
And on that note, I would just like to propose, considering that, on that note, I'd like to propose that considering we have 19,000 nonprofits already in this state alone, that perhaps rather than starting a whole new coalition that is one of its own, we find something that's already established and do an onboarding process to get them fully engaged with this. I think that would be a lot more effective in our community than trying to complete something straight from scratch.
Perhaps making all of those nonprofits trauma-informed would be an interesting phenomenon. I'm going to jump a little bit over because I want to give the microphone back to Robert. Just to go over a few obstacles, which I'm sure everybody in the room knows. Turf issues, silos of information, which I think is a really crippling force in the whole world of social sciences. We don't share with each other. In fact, one of the things that has really impressed me about the ACES Connection people is their willingness to share what they know. Because I've been in other academic environments where people kind of keep their information like this and you can't get near it. The trauma people will give you anything you want. It's really great. It's like, hey, can I borrow that? Oh, sure, go ahead, take it. Because I think there's such an urgency among them to make sure that people are aware of what can be done and how it can be done best. So I think we need to continue to kind of look at that. A bad history or bad limited links to the community, I think that's certainly an issue for schools sometimes. I don't know about other social service agencies, but it's hard to kind of get in the community and stay well received, I think, if you're among certain professional groups. And then the dominance of some professionals within the coalition instead of the people that we're supposed to be representing. We do like to hear ourselves talk, we professionals. Sometimes it's better to listen. And so I'm just going to wrap up with the 6 R's for maintaining a coalition, and then I'm going to give the mic back to Robert. Recognition, respect, role. This is, again, what Deborah ended on. Relationships, it's all about relationships instead of just showing up. And relationships take time. I think that's the other thing that we as Americans sometimes don't appreciate. Like different cultural groups get, you should have like 4 turns before you start talking business. So if you work with the Hispanic community, you know, they're asking about your kids, they're asking about your vacation, what you had for dinner last night, you know, and then after we do all that and reestablish the relationship, it's like, okay, now let's get down to business. Whereas, at least on the East Coast, you know, we go right for the jugular before we do this hello. Okay, hi, sit down, we got business to do. And it's like, excuse me, who are you? When did I see you the last time? So I think that's something we need to think about. And again, the results. There needs to be results or people don't want to play anymore. So Robert, you ready to do the next show?
I want to tell you, this is along the lines of why I believe so much in getting this information to the people affected by it the most, and also the idea of expanding leadership. I was in Walla Walla, Washington about 8 years ago, and it was an evening meeting, it was a community meeting, people from all over Walla Walla, and there was probably about 200 people in this community center, and I did a presentation that was much like the one I did this morning. At the end of my presentation, a woman came up from the back and ripped the microphone out of my hand and started talking, and I freaked out because I've never had anybody rip the microphone out of my hand as a presenter before, and I actually don't remember what she said.
Yikes.
And I was in Canada a couple years later with one of the staff people there, a woman named Sasha, and she said, "Rob, do you remember Annette?" I know, well, who was Annette? Well, she's the woman that ripped the microphone out of her hand in Walla Walla, Washington. She said, we have a video of it. I'd like to see that video, and I'm going to, if we can get this to work, I'm going to show you that video. The only thing that I want to tell you, she talks about taking the ACEs test. That's it, the one-page finding your ACE score that I sometimes use in structured settings for audiences, and I happen to use that at that meeting. So if we can show the video, this is Annette.
I was invited to the conference for the meeting out of the college, and I came not really knowing and not really understanding the whole thing, but I wanted my sister came along with me also, and he started going through all the questions and about your childhood and how it affected the way you are today and things like that. And my sister and I both sat there and we filled out the paper and it said to take the ACEs test and stuff. And we could say yes. You say yes or no to the questions, and we could say yes to all 10 of the questions. And I thought, I can't, I'm tired of, my life is just going nowhere or anything, and I'm tired of just being nobody. I have to do something about it, and something happened. And I just was like, I woke up and realized that nobody's going to change you and nobody's going to do anything for you. You have to be willing to change and do something for yourself. I've had so much negative in my life and not hardly any positive. And so I went through the motions, with my kids and trying to parent them the best I knew. I went through the motions of going to the school meetings and showing up and another one, and over and over and over. But now it's more of, I'm in the middle of it, I'm involved, I'm a part of, and they're listening to me. They know, when I want something for my son, they know where it's coming from. The saying, it takes a village to raise a child, that's my favorite saying in the world. Because my village came together. After the ACEs presentation was when it was like a wake-up call to me. It was time for me my life was not going anywhere. It's time for me to wake up and stop being a victim and start being a role model, start being a human. I feel like I can live now. I'm out of my shell. I don't have to hide. I don't have to be the victim. If I'm going to help my son, I have to help myself first. You have to want to wake up. You have to want to change. And I wanted more for my children than what I had.
Annette, the evening of that meeting, Annette was living in her car, homeless with her 2 sons. And she said it takes a village. She lived in Walla Walla. It was one of those villages where people knew enough about ACEs and looked out for each other, and there was a community leader there that knew her and suggested that she come to that meeting. Otherwise, she would not even known about it. I'm told that she never talked to anyone, and yet she came up with the microphone on her hand and talked to that audience. And I was just told recently what she said. She said, I have 10 ACEs and I'm not broken. And she wanted the people. She wanted the people in her community to know that. I'd like to. We still have the mics out there. She said a lot of things. I watched this many times. She said a lot of things that have a lot of meaning to me about what the information can do and the possible transformations that can happen. Does anybody want to say anything about what you heard her say about herself that stood out?
share that not only what she had to say, but one of the things I really resonates today that I'm hearing is the importance of the family's voice in this conversation. And I want to thank Potts Family Foundation and all the speakers for today. I, like Deb, am very invigorated and exhausted at the same time.
Yeah.
There's a couple resources that wouldn't be here without the Potts Family Foundation around family voice. So they have sponsored a parent partnership board that we have, and these are these parents living, raising kids in Oklahoma and struggling every day. And with Potts Family Foundation, they're learning how to share their voice. And they've shared their voice in a lot of things in primarily Oklahoma County, but they're not limited to that. But if you have a coalition, if you want family voice, they would like to share. And so I want folks to be aware of that. And they also informed the Parent Pro website, which is a website for Oklahoma parents about resources for parents who are experiencing ACEs and have children that experience ACEs, so parentpro.org. And I hope people are aware of it. And if you want to add your resource to that website, let us know, because it's an ever-growing endeavor.
Thank you.
I noticed that she said she wanted more for her son, and she really had to want more for herself, that she really had to work on herself to be able to work on him. Now, I'm a nurse, and I come from a hospital, children's actually, that says that we're family centered. We want to treat the entire family, not just the patient. Now, I don't work in the hospital anymore. I work in a public school system, and with limited funding, we often focus on the kids and not necessarily so much the parents. And I think it's really imperative that we start focusing on the entire picture, not just the kid. So any resources that you have for public school systems,
Thank you.
One thing I noticed that she said is, in 1 minute she said, no one's going to do this for you, or no one's going to give you that, you have to get it yourself. And then another part, she talked about how her village came together. And one of the things, and one of the speakers talked about attachment, that is one of the biggest things when you have trauma, is people do think you're weird. I spent my entire childhood calling you weird. And you yourself don't want to get hurt, so you close off. And I see the little first graders doing that. Some of them, it's their first year in school, and they close themselves off. We get a lot of kids from the Jordan's Crossing whose parents have just gone into drug treatment, come in kicking and screaming. They don't want to have anything to do with kids. And so that attachment, she's feeling alone, but yet she can also recognize. So she sees the logistics. She sees that people came together, but she's still feeling very alone and not part of that group. And that attachment is extremely important, especially on the kid level, that no matter what, like I have kids in and I say, I hope you guys are treating my new friend good, because being the new kid in school, I went 31 times as a child. Being the new kid in school is so hard to try to make an attachment. And the fact is that if you don't help them with that attachment, they're always going to be the wallflower, or they're always going to be the kid that acts out. If you can help them to make another friend, someone that will help them on their own age, in their own collaborative age group, you know, you can make a friend with them as an adult, but if you got to help them make friends with their other age group.
I think that woman brought to light really is how ashamed she was of all of her ACE scores before she realized that other people experienced that. I'm a 7, and I'm an awesome mother. I was able to break the cycles of abuse and all sorts of horrific things that I'm sure a lot of you have experienced. If not yourself, then in the community and other agencies. And this movement allows people to not be ashamed of it and to know that they can overcome it and stop the cycles and stop the ending up just like their parents. And that's really what I saw through that, was just strength and courage and community, and knowing that she's not alone and that she is a 10 and she is not broken. And I think pretty much all of us are at least a 1.
Most of us.
Really? Well, yeah.
2/3.
At least one, statistically.
Yeah.
Dr. Onda and Susan Craig, this is kind of interesting towards you, but things that you can do in schools. I was a principal for a long time, and some of the things we did, we had conflict resolution for the kids. And we had peer mediators and things, and they would go out and they would, at recess, when there was conflict or such, they would take this to students that were involved in, and instead of me having to get after them and do something with them, they would let them work it out between themselves and learn how to work that out. Another thing we did was love and logic classes, and Sarah here is an example of that.
When my boys were in the Putnam City School District, they were, I think, about in 6th grade, 5th grade, and kindergarten. And Margie was teaching a love and logic class in the school, and I attended, and there were really only probably 5 or 6 parents. It was a small group, and I thought, what am I going to get out of this? And I only was able to attend like 3 or 4 times. But the tools that I received, from listening to Margie talk about the consequences, using love and logic and tying the behaviors, to consequences. I remember, I didn't understand why my kids wouldn't just listen to me, and I didn't believe in spanking. So it's like, what's the alternative? And I just learned so much, and it was because of the school offering that class, and there weren't very many kids in the class. Parents listening to this, but I was able to apply it very quickly, very easily, and my kids responded, and I was really amazed. So it really does. I want to thank all of the teachers in this room, because you are so very important. We all know that, but you're not feeling it, you're not receiving it, and so just hang in there. I'm so glad you're here. There's so much we can do for kids in Oklahoma, and I appreciate everybody who is here sharing this knowledge with us so that we can take it to the next step.
That was nice for
I think she used the word empowered her. And I think that's what we need to do for parents, is empower them and to take charge of some of their learning for their students. They know as a child more than anyone else.
That's a good ending.
I heard what some of you heard is and what Deborah talked about is shame. She said, I wanted to be human. She didn't feel like she was human. She changed her relationship with her son. She got engaged. I think she was able to be present for them in a way that she wasn't present before. She said she was just going through the motions, that she was tired. She became engaged in the school, became a member of one of the parent organizations there. And now she has, with some coaching, because she's in a community where people support people like Annette. She had some emotional coaching, and she now, several years later, she has her own foundation. She has her own foundation to help homeless people in Walla Walla, Washington.
That's awesome.
I think for me it emphasizes that need to remember that the people affected by ACEs are the people that have a lot of power to change their own lives, to change the way they interact with children, and to become leaders in their community. She's now a leader in her community, and she was homeless that night about 8 or 10 years ago. And so that, to me, that's an example of what can happen with this information that can empower people to restructure, reframe the narrative of their lives, and create a new one if they have people supporting them in their community. And that's what I talk about when I talk about this being scalable and sustainable. And it's really, well, that didn't cost, what did it cost? For that woman to transform her life, to work with the school and her children differently, and help other homeless people in Walla Walla, Washington. So
That's good.
That's just truly an incredible story. So I'm going to stop there and turn it back